We're here with Dr. Jean Menezes. He is a member of St. Luke's Medical Guild Goa and has been a practitioner in the field of medicine for the past 10 years and is a specialist in cancer disease. We're very thankful to have him here. And we get to know more about this disease, how to prevent it, and what precautions to take. 4th of February is World Cancer Day, and we have with us Dr. Jean-Louis Menezes, correct?
Yes.
Okay. This gentleman here is what we call an intellectual who knows a lot about cancer. Why are we seeing so much of cancer in today's day and age?
So there are multiple reasons why we would have this scenario. One of them is that our overall survival is improving, and we have patients living into their 80s and 90s. So a lot of cancers are age-related. So we do see a lot of 80-year-olds with cancer. If they had to perhaps die of typhoid at the age of 40, we may not have ever seen this patient. The second reason is that we have better diagnostic facilities. So previously, if somebody lost weight and became thin, we might have said this is tuberculosis or consumption, and we might have labeled it at that. But now we have all sorts of scans and blood tests, and we then find out that, oh, this is actually a cancer. And the third thing is there may be an actual increase in the number of cases that may be related to pollution or lifestyle or alcohol and tobacco. And these are the ones that are worrisome, if it is actually the third reason that why we are seeing more cases.
What are the most important things that one needs to know about cancer as a disease?
So cancer is actually it's a lot of diseases that are clubbed together under one term, but basically it's one part of your body starts growing too much, and it deprives the rest of your body of nutrition and then eventually kills the patient. So the cancer itself has various causes, and the causes will vary according to which part of the body is the most important, which part of the body is affected. So what you should know is that the first thing is that don't believe everything that you read on the internet, and definitely don't believe everything that you read on WhatsApp. So the thing is that there is a lot of misinformation, and there is a lot of a hype created about alternative therapies. There is a lot of fear spread that if you do an X procedure or if you do Y, then the cancer will spread. So we do see patients who have refused surgery or refused treatment because they think that the treatment will kill them. So don't believe everything that you read on the internet. If you do think that you have something that might be a cancer, it's better that you go and check with your doctor rather than consulting Dr. Google.
So no Dr. Google, but considering you know and you've had so many patients, cancer, you said, can happen to any part of your body. But what are basic symptoms and signs that you can, detect an early tumor or a cancer?
Okay, so let's focus on the common cancers that we have. So we'll start from the top, head to toe. So if we look at the oral cavity, which is quite common, you'll see small little red patches or whitish patches on the tongue or inside the cheek. And these are something that may not pass away in a short while. And if it grows a little bit more, then it may become a reddish thing, or it may become an ulcer.
Okay.
Occasionally they may bleed. And the important thing is none of these are associated with pain when they're small.
Okay.
So generally patients would neglect it because it's painless, and then they would wait till it becomes big enough to pain them, and by that time it's already quite big. If you notice a little lump in the neck or a swelling on the cheek or near the eyeball, these are common things that would might indicate that there is a tumor, either cancerous or non-cancerous.
So we're looking at protruding skin
any
inflammation.
Lumps, any lumps, bumps, or any red patch or wound that does not heal within a couple of weeks, then we would think that this is something abnormal.
Okay.
Also, if you go down into the chest, if you keep having a cough that's there for more than 2 or 3 weeks, or if there's blood in the cough, then you would definitely be thinking that this might be a malignancy. So also, now if you're looking at the breast, which is very common in Goa, so then the breast cancers would, the early signs may be just like a small little hardening or a little bit of blood coming out of the nipple. And these would not be pain, there would be no pain. Sometimes the lady may not even feel a lump. And occasionally we might have a situation where the skin looks a little bit pulled or a little bit thickened. And that may be the only thing that is there. So if any of these things are there and you notice that there's something off, and it, again, the bottom line, if it persists more than 2 or 3 weeks, then it's better that you go and see your doctor.
Okay. Considering you said that 2 or 3 weeks is a time frame, should people, and you said there are common, there's the gland that can catch cancer. Is there a certain time frame in which people should go and get checked, or a certain age after which they should go and get checked for cancer or for some symptoms of cancer?
Yes, so it's not really feasible for everybody to check themselves head to toe every time. So we look at a risk stratification. So if you have a family history of a particular cancer, then we would say go and get checked by a doctor at least 10 years before the youngest relative who has had that. So if you had the closest relative has had breast cancer at the age of 50, then maybe you would go in and have a checkup at the age of 40.
Okay.
And the doctor would advise you then how you would go along with it. This is a family related cancer. But if you have other risk factors, supposing you have certain diseases like cirrhosis of the liver or certain lung diseases which predispose to certain of these cancers, if you know that I have this problem, then you should go on a regular basis to check with your doctor. If you are a smoker or you're a alcoholic or somebody who chews tobacco and pan, then the first thing you should do is obviously stop these things and then get yourself checked regularly, maybe every 6 months to a year by your doctor, so that he can advise you what needs to be done.
What about mammography and pap smear? How long should a woman wait, or what age should she wait to start checking herself or going to a doctor for a checkup?
So about 20 years back, the recommendation was do a mammogram every year after the age of 40.
Okay.
And we've changed that now quite a bit. It doesn't really always help if we do it that frequently. So currently we would recommend doing a mammogram once around the age of 45 to 50, and then maybe every 5 years or so after that.
Okay.
But the more important than a mammogram would be feeling the breast yourself, and if you have even the slightest doubt, going to your doctor and getting a breast examination. So a clinical breast examination is found to be generally more useful than just blindly doing a mammography every year.
Correct.
So also doing a pap smear every year is not as useful as going and getting checked by your gynecologist once a year. Even if you do the pap smear once in 2 or 3 years, that's okay. But the physical examination is the one that is more likely to pick up something early.
Rather being more aware of your own body and how it is, going places, I think for women especially, being more self-aware about, any glands or some protrusion, I think that would be...
Yeah, so the rule of thumb is if there's a lump or a bump and it persists, then you should get it looked at.
What are the other tests, clinical tests, that can be done to detect cancer?
So currently, again, we look at a risk stratification way so that we don't unnecessarily keep doing a test for everybody because it's expensive. And also we should not miss somebody who is likely to get a problem. So like I said, the mammography and a pap smear would be maybe once every few years after the age of 40, 45. But in high-risk patients, if there's a very strong family history of a particular cancer, we might do more sensitive tests. For example, we might consider doing an MRI if there's a very high risk. But those would be only under the recommendation of a doctor. I wouldn't advise doing an MRI just on your own because it throws up a lot of red herrings. Other systems that we do look at is the lungs. So if you're a heavy smoker or you have been a heavy smoker within the last 15 years, then we might consider doing a low dose CT scan It's a special type of CT scan that, well, you can do it on a regular CT scan machine, but it has to be done so that you get a low dose of radiation. At the same time, we scan your lungs and see if there's a small tumor in the lungs, which is easy to miss on an X-ray. If in Goa, I would say that more than lung cancer, we also need to look at colonic cancers. And the simplest way to do that is to do a stool occult blood testing, and you need to do it on 3 consecutive days. And since it's a simple test and it's cheap, I would say we should do it maybe every year after the age of 40 or 45. And if there is even the slightest doubt, then the doctor might prefer to do an endoscopy and see the inside of the colon with an endoscope. So these are some things that we can do, that we can help. In men who are between the ages of 55 and 65, we might consider doing a PSA, that's a prostate specific antigen test, once every year or every alternate year. But again, this is not a very solid recommendation for the PSA, because again it throws up a lot of red herrings. So, but it's not a bad test to do between the age of 55 and 65. If you're 70 or 75, then just going blindly and doing a PSA doesn't make sense. Unless your doctor examines you and tells you, I want you to do a PSA, you shouldn't just go and do it one on your own.
Okay.
Yeah.
Considering one goes for, say, a test and sees a couple of positive signs, the doctor says this is probably a cancer, and people go for multiple, suggestions, multiple doctors. What are the treatments available, if we could go in the same order? And
Yeah. So generally, the currently accepted treatments for cancer, whether it's a pre-cancer or whether it's already formed a cancer, the current treatment would be surgery, radiation, or chemotherapy, depending on the type of cancer and what stage it is in. It may be more than one of these treatments in combination. This treatment has to be decided by somebody who knows what they're doing, somebody who's dealing with these diseases every day. And rather than relying on WhatsApp and internet to look for alternative remedies, it's better that you go to somebody who's doing this regularly, see what they say, and if you then have a doubt, you can Google as to what his opinion is. But I wouldn't recommend just Googling what is the treatment of so-and-so cancer, because you'll get a whole lot of junk on the internet, and you can't really trust what you read on the internet. So it would be safer to meet a specialist, get the opinion that this is what I need to do, and then go ahead and do it. Most cancers are curable if they are caught on time. The biggest problem is that people tend to ignore this cancer, or sometimes they deliberately hide it because they are afraid either socially of being labeled as a cancer patient, or they are worried that they may lose a body part. Like women might be concerned about losing a breast, somebody might be concerned about losing his tongue if he's got a tongue cancer, or a penile cancer, or a testicular cancer. So the patient might be concerned about it, and this causes a fear to take treatment. And on top of that, now you have the internet coming up with all these various supposed vitamins and supplements, etc., which don't really help. They don't help.
a very commonly asked question by women is, do the breasts have to be removed compulsorily if one is detected of a breast cancer?
So this is something again that I'm struggling very hard to educate people with. I've seen a lot of patients, especially the younger ones, refusing treatment because they believe that if you have a breast cancer, the whole breast has to come off. Today, that's no longer the truth. For the last 25 years, it's been no longer the truth. Okay, since a study established in 1991, we now know that it is safe to preserve the breast under selected circumstances. And the most important thing is if you have got a small tumor. If you've got a small tumor, then yes, it is safe to not remove the whole breast and still be cured of the cancer. It requires special treatment. It needs to be done by a specialist. But yes, it is safe and it can be done.
Colostomy, what is it, and is it necessary for a colon cancer?
So a colostomy is basically a passage for stools on the tummy. And traditionally, and when I'm saying traditionally, I'm talking about 50 years ago, whenever a patient had a low colonic cancer or a rectal cancer, they would have the cancer removed, and then the patient would have the stool passage made onto the patient's tummy. Okay, and that was a little bit of a social stigma because you'd have stools coming out of your tummy. But today, with our better understanding and some better technology, the majority of patients, even if they do have a colon cancer or even if they do have a rectal cancer, we are able to take off the tumor and usually join the ends back down so that the patient can pass stools normally. So that's the first part of my answer. The second part of the answer is that even if you do require about a permanent colostomy, which about 20 to 30% of patients might, even if you do require a permanent colostomy, today the bags that are available and the appliances that are available for the colostomy mean that you can go through life completely functional, even though you've got stools coming out of your tummy here. So there are plenty of people who are holding very good jobs, who are in public life, and there are many poor people, farmers, etc., who are also completely active with a colostomy. So a colostomy is not the end of life, it is just freedom from cancer.
Is hysterectomy compulsory for urine and cervical cancer?
So hysterectomy basically means this is a removal of the uterus. And there are, again, this concept is that if there is a cancer, you get it out. And a lot of the time, just like people who have breast cancer used to believe that you have to take the whole breast off. If you have a cervical or a uterine cancer, they think that you have to take off the uterus. In many cases, it is necessary, but in select cases, you might be able to avoid that. Of course, it needs a special judgment as to when it can and cannot be done. And it is possible to save these organs sometimes. The corollary is also important that sometimes it may not be enough just to remove the uterus. In such cases, we may try things like radiation because the tumor has spread outside the uterus or the cervix. So very often I would get patients with an advanced cervical cancer asking me to take it off.
Yeah.
And if it's not really going to help, then you shouldn't be doing the hysterectomy on that patient. But the patient's mentality, and perhaps somebody has told them that you need to get it out, and that doesn't always help either. So it has to be a proper decision as to whether it needs to be done and whether it can be done.
Correct.
And that needs to be taken by somebody who's doing this regularly.
The next question is bone cancer, everybody has the stigma about bone cancer. Is bone cancer curable?
Answer has two parts. When people refer to bone cancer, it could be a cancer of the bone tissue, or B, it could be a cancer of the bone marrow. Both of these have traditionally had a lot of complications and a high rate of death, but in the last 10 years or so, there have been a lot of advances made, and today, if you have a bone tissue cancer, that means proper bone cancer, the survival rates are quite good. And not only that, these cancers are very common in the arm and in the leg. So previously, these patients would all end up with an amputation. Today, the majority of patients, we are able to take off the tumor and reconstruct the bone so that you no longer need an amputation. So things have progressed a lot. Yes, there are still some things, there's a way to go, but there is a lot that can be done. The second part, bone marrow cancer, again, basically a leukemia. Again, there have been a lot of progress in some types of these cancers, and yes, a lot of them are curable. So if somebody does tell you you have a bone cancer, which sometimes is misinterpreted as bone marrow, whichever way it is, get a proper opinion, get all the tests done, and yes, the chances are that you will be cured of that.
All right. And the most scariest of it all, as people say, the blood cancer. Is it curable? How to detect it, I think, is another question.
Yeah, so the blood cancer is a manifestation of the bone marrow cancer that I was talking about. So again, most of the time these patients are detected because their hemoglobin has gone down too low, or they develop some clots and things like that. There are no regularly recommended tests to detect a blood cancer early. But depending on the type and depending on the treatment and age of the patient, yes, it is possible to potentially cure these patients.
And what are the symptoms, or are there any certain symptoms to look for with bone as well as blood cancer?
So for bone cancers, sometimes the earliest sign is just a slight pain that refuses to go away. And if it's pain at the same area and it stays for more than 2 weeks, then we would say don't ignore it. Go to a doctor, get it checked out. If necessary, do the x-rays or the MRIs. A lot of the bone cancers occur in young patients who are in their 10, 15, 20-year-old bracket. And we tend to dismiss off, oh, he was playing football and he got an injury. And that sometimes delays the diagnosis. So if a kid complains of this pain at the same spot and it's there for more than 2 weeks, then it would be better to go ahead and see a doctor and get the thing checked out properly.
Correct. Can I have a prophylactic breast removal to prevent breast cancer?
So the simple answer is no. The simple answer is no, because today we do prophylactic surgeries for very few cancers. One of them is breast cancer, but we don't do them in all patients, as in we don't do them in all women. We do it only in women where we have got a blood test, a genetic blood test, that proves that this lady has a genetic mutation that increases her risk for breast cancer. Only in those patients where the risk of developing a cancer is between 75 to 100%, we would consider doing a surgery and taking both the breasts off. So there was a lot of popularity soon after Angelina Jolie had this procedure done a few years back. And so a lot of women, out of fear, would come and ask, do it. And it's not really justified, and there would be no benefit to doing it to all women. So today we would do it only if you have a genetic mutation that's positive with a high risk for malignancy.
One of the questions that I think I personally wanted to, ask is, when you have a friend or a family member concerned about getting a cancer and then is probably positive on a cancer front, what would your advice, honest advice, to the family members, friends, and people who are with, people who have just realized they have cancer and who are cancer patients?
So, like I said earlier, things have changed a lot in the last 25 years. If we look at the breast cancer survivals from the 1990s and compare it with that in 2010, there is almost a 25% increase in this patient survival. So whatever cancers you have and whatever you might be told, it's better that you try and take the treatment that your doctor suggests, because that gives you the best chance of getting out of it.
So thank you so much for being here with us, and I hope all the information that you've given is, reached the viewers. And I think the biggest takeaway is, do not believe the half knowledge that is floating around on social media, and get someone who knows what they're talking about. We would like to know a little more about you, considering we've learned so much about this disease that you've made it simple and you've put it out on the table. Can you tell us more about what your work is and how long you've been working with cancer patients?
So I've been dealing exclusively with cancer for almost 10 years now. I've come back to Goa 2-3 years back. The difference that I've seen in cancer in Goa as compared to the rest of the country is, we do tend to have a lot of breast, ovarian, and colon cancers in Goa. We don't tend to have as many throat cancers and tongue cancers as we would have in the rest of India, because probably we don't have tobacco and pan chewing as a very common habit. So these are the common cancers that we see here in Goa: breast, lung, colon, and ovarian. And we do see a fair bit of lymph node and bone marrow cancers as well. So the treatments the majority of the treatment for these cancers can be safely done in Goa at present. In select situations, we might need to take some part of the treatment outside Goa because facilities may not be available. But in general, the majority of these cases can be treated very safely in Goa. So that should not be a deterrent from the patient seeking treatment.
All right. Thank you so much for the information. And yes, I hope the information that we've given reaches to all our viewers who are watching. Thank you.
Thank you.